Question: Can you treat C. diff with flagyl? I mean,
C. diff is treated with vancomycin oral. And I'm glad you said that, you guys. That's a good thing to know. On that same page where I told you those fluoroquinolones give you C. diff, make sure you know that C. diff is treated with vancomycin oral. It's got to be PO. It used to be that we treated with flagyl. It's resistant now. It doesn't work anymore. Okay, so yeah, we can treat it with Vanco, oral, Vanco, PO, not IV. It will not do anything to do IV. Okay, now the next page, and so many of our people are lost their goddamn mind about vaccines. Hopefully you'll find your man today. Now, so you have something on your test called artificial acquired immunity. Now, my favorite story during COVID is we had all these, let's just say, knowledge deficits running around here. And one of them was in my class, because I had told her, you don't get the vaccine, you don't come back to class. I ain't finna kill my patients because you're on some trash. This student who did not want to get the vaccine and still wanted to come to class, but was completely forbidden, she went down to Mexico to get a BBL. I need you to reconcile that motherfucker. Reconcile it in your motherfucking mind. Let's just think that shit through. So you went to some surgeon in Mexico where they ain't sterilizing half a shit, and you let him give you a new ass and paid him well. But when I tell you I ain't trying to let you kill my kidney transplant and my cancer and my pregnant people in this class, you on some bullshit. It's a sign of the times. It's a sign of the times. Y'all doing all kind of dumb shit. Okay, so let's educate ourselves, shall we? First of all, it says artificial acquired immunity. Now I'm gonna hook you up. This is a great trick, y'all, because these are so confusing on NCLEX. When it says artificial, say to yourself, Shelly said, every time I say artificial, it's made in a lab. Every time it says artificial, it's got to be made in a lab. So artificial tells you right there, it's probably, the answer is probably vaccine. Not always, because it could be at the bottom, immunoglobulins. You see at the bottom? Two different things. So if it's an artificially acquired active immunity, it's a vaccine. If it's artificially acquired passive immunity, it's immunoglobulins, and this is what I need you to do. Highlight the word that says antibodies in the second line under there. Now let's talk shop. If we want to manipulate medication in a lab to give you a vaccine, that is easy to do, no big deal. That's what it is. It is not easy to do immunoglobulins, because this is where a person had the disease, recovered from it. We took their blood or plasma, took it to a lab, very much like we just did this, took it to a lab and chemically altered it so you're not messing around in biohazard material. You just got a little fluid or whatever. And that will be called an immunoglobulin. Now, we just started in the last 10, maybe 15 years, making synthetic immunoglobulins. Here's what the last three letters are going to be. M-A-B, monoclonal antibodies. That's what MAB stands for. Monoclonal antibodies. Now, there was upon a time, and you guys are kind of young, I don't know if you remember this, But there was a situation where we had Ebola, and there were 2 nurses that had Ebola, and they were going to die. The doctor that had Ebola recovered from it. So what does that mean? He's got what? Antibodies. He donated his blood. They took it to a lab, extracted the antibodies, and the only way those 2 nurses were saved was they got a transfusion of his plasma. That is if I took it from the person and gave it straight to another person. We were doing that with COVID before we got a cure too. Now, we done got real good at doing it synthetically. So you will see a bunch of letters. The one I want you to highlight the most is the one that says H big and V zig. H big and V zig. So let's talk shop with my patient. I just told you that pregnant patients are immunosuppressed. As a matter of fact, chicken pox in a kid doesn't do anything to them. She was exposed to her 8-year-old niece. It damn near killed her. So pregnant women with the chicken pox will get deathly ill pneumonia. She was on a ventilator. I had to deliver her baby with her on a fucking ventilator. So that was crazy. Now, she's got the chicken pox. She's got deathly ill pneumonia on a ventilator because she got exposed to her niece. And when I deliver this baby, can I give that baby a varicella, which is chicken pox, vaccine? No. Remember, your vaccines can't be given that young, not that vaccine. So I always teach you to remember the song. Measles, mumps, rubella, varicella. Woo! Now, so you gotta know the song. Measles, mumps, rubella means MMR vaccine. Measles, mumps, rubella, varicella. Varicella is chicken pox. So measles, mumps, rubella, varicella, you can't get that to pregnant women or babies. Really young babies. You can't get that to them. They got to be older. So I just delivered this baby. I can't give it measles, mumps, rubella, varicella, but I know damn well this baby's been exposed. You feeling me? It just came from mommy. So what I have to do is give this baby a varicella zoster immunoglobulin. Now, VZIG, you see it? VZIG, varicella zoster immunoglobulin. Now, those of us who are old, we thought y'all had lost y'all damn mind when it came to these vaccines, because a lot of us in the field as nurses remember when they came around and they said, okay, we got good news, nurses and doctors. We now have a vaccine for hepatitis B. I'm so old, at 60 years old, I started my career with no hepatitis B vaccine, which meant we saw hepatitis B every fucking day, and it killed every fucking day. When a pregnant woman had it, it was catastrophic. And hepatitis B, before the vaccine came out, was once you have it, you'll never get rid of it. You can infect everybody you ever be with. So we were real thankful for the hepatitis B vaccine. There was no Facebook, Instagram, and bullshit TikTok. None of that existed. So nobody got an attitude problem and lost their goddamn mind over no hepatitis B vaccine. So the way it worked was we was told, okay, nurses, doctors, line up, get your shit. We were thrilled. No picket signs and all this bullshit. Now, I will give it to you like this. I can't fucking tell you the last time I done seen hepatitis B in any patient, because that's how long the vaccine been out. When babies are born, they get it in the newborn nursery. I haven't seen hepatitis B since the 80s when it came out, because this shit is so effective. But let's talk about the good old days. I have a hepatitis B patient who's pregnant. I work in high-risk OB. I am delivering this baby. The baby is what? Exposed to mommy. So I've got to do what? Give them an immunoglobulin. So here we go. Hepatitis B immunoglobulin. The one at the bottom is for rabies. Human rabies immunoglobulin. So what I'm trying to tell you, and it's a good rule for the babies, vaccines are pre-exposure. Immunoglobulins are post-exposure. Yep. No problem, baby. So vaccines are pre-exposure. Pre-exposure, prevention. Immunoglobulins at the bottom are post-exposure, after you've been exposed. Now, every single person in this class will get a needle stick. Every one of you. Hopefully you'll never get the exposure that I got, which was real fucked up. So when I grew up as a nurse, it was during the 80s with cocaine and crack and crazy. And this particular day, I was an RN starting an IV on a patient who was 27 weeks pregnant, bleeding profusely, having her premature baby, and high as fuck on crack, okay? Now, so when I'm trying to put the IV in her arm, she did this, jerked it back. And when she did like this and took her arm away from me while I was trying to put the IV in, it sprayed my mouth with blood. She was also HIV positive. Now, obviously, that was earth-shattering. And if I couldn't make it any worse of a story, it was a couple weeks before my wedding. You know, I've been married 17 times. This was the first one, so I kind of gave a fuck. So I remember going home and saying, you ain't got to marry me. I wouldn't even be mad at you. What if I got this bullshit? I won't know for 2 weeks. He's like, shut the fuck up. So here we go. And again, it's teaching you what we just said. Here we go. Post-exposure protocol. Very important that you see the post. The first thing you do with the needle stick is you milk the wound under running water. In my case, I rinsed my mouth for damn near 20 minutes with running water. Like I just kept spitting and I mean, I was nauseous, right? So I was really gagging. Okay, you done did this. Oh my God. Okay, now, if the person has not gotten a tetanus shot in the last 6 years or so, we'll give them that. We'll give them a tetanus shot. We're going to draw their labs, in my case, my labs, for HIV, because what if I had the shit before? And I'm blaming the fucking patient. I've already been a hoe, and I got this shit from my hoe days. Y'all don't know nothing about that. We ain't no motherfucking cell phones back then. You ain't no recording of none of that shit. Y'all can't do shit now, it's on tape. Okay, so they check my HIV. They want to make sure I'm not pregnant because the medicines they may give you could hurt. And remember, this is on your test. HCG, human chorionic gonadotrophin. Hepatitis B and C, because again, we had so much of that back then. Liver function test, because the medication they may have to give me may hurt my liver, so they want to know what my starting situation is. And then, look what I wrote. Then exposure-based therapy. So I had to go on to, what did they call that back in the day? They called it AZT, now they call it Truvada. And it says immunoglobulin, that's what typically exposure-based treatment is those antibodies. VZIG, HBIG, then chase it with the vaccine. When the baby's old enough, when the patient's not pregnant, you can chase it with the vaccine. Now, Truvada is the brand name. You're going to have to know this name for the the HIV treatment, post-exposure treatment. Emtricitabine. Tricitabine is Truvada. So Truvada is a brand name. All your meds on your test is generic. And then we retest you 6 weeks, 3 months, 6 months. Emtricitabine is for post-HIV, possible HIV exposure. Nowadays, we have quick testing, so you only have to take 1 pill usually until tomorrow's test come back. Back then, you waited 2 weeks. Yeah, that was horrible. I lost a lot of weight right before my wedding. My dress was falling off of me. I had to have it sewn on me with a bar of pearls. It was crazy.
6 years?
Because it was side effects.
Is the retest 6 months?
6, 3, 6. 6 weeks, 3 months, and 6 months. 6, 3, 6. You probably won't. Well, you might. So 6, 3, 6. 6 weeks, 3 months, 6 months. In other words, one test is not good enough. You have to keep checking to see if they seroconverted. Think about it like this. If I just got it, it wouldn't show up anyway for a little while, right? I mean, that's just common sense. Okay, so that's this. What I say about artificial mean what?
In the lab.
You got it. Now let's turn to the one that's going to say natural. This is natural acquired immunity. So you know we're not in the lab no more, right, boo-boo kitties? We're not in the lab no more. This is very important. So naturally acquired active immunity, this one at the top, the person got the disease. Maybe you should write that. The person got the disease. The patient got infected. So, examples of natural immunity. Chicken pox. Once you get it, you ain't getting it no more. Measles. Once you get it, you ain't getting it no more. Chicken pox, measles, mumps, rubella. Once you get it, you ain't getting it no more. Now, hepatitis A is another one. So here's what I'm saying to the babies. 99%, notice I did not say 100. 99% of people who get measles, mumps, rubella, varicella is chickenpox, will not get that ever again. 99%. Now, some diseases give you some, what does it say? Naturally acquired active immunity. They don't give you a lifetime like measles, mumps, rubella, varicella. They don't do that. But they give you a little bit. What disease is that? My favorite one to use because you understand it thoroughly is COVID. One thing about catching COVID, you wasn't going to get it again for 90 straight days. We counted it down. You were not at risk again for getting it. So you're the safest person to be around. Once you recovered from it, you ain't finna get it again. Not for 90 days. It gives you limited natural acquired immunity. Limited. Now the bottom of the page, naturally acquired passive. Think about the mother passing it to the baby. This is why, and yes, you do have to know this. This is why we give pregnant women DTaP and RSV. So we now give pregnant women 2 vaccines, DTaP and RSV, to protect this baby. We want her to pass it to the placenta, and then when she delivers and breastfeeds, we need her to pass it through her breast milk. because we're having too many babies dying of this shit. And right now we have an epidemic of pertussis. Because again, people just done lost their goddamn mind about vaccines.
There's been a lot of people in the emergency room coming in with adults coming in with
RSV, yeah.
I'm like, wait.
Yep, they got a vaccine for elderly too. Yep, so look at the page at the bottom. If you see something on your test that says vertical transmission, perinatal transmission, all that means is mom to baby. Vertical is during delivery, perinatal is anytime in the pregnancy, delivery, or postpartum. The placenta has IgG. Breastfeeding gives you IgA. Those are called antibodies. Y'all all right? Okay, sugar muffins. I'm not either. I'm going to lunch. Okay, y'all need to come back at 1:15. I will see you soon. I got to bounce, and I got to bounce fast, so I can't talk to